So lots of holiday baking starting. Okay, great. We're going to go ahead and start. Thank you all for coming. This is the end of the year. We have special guests today who are going to answer lots of questions and even ask you all some questions. But before that, as we're looking forward to the new year, we wanted to ask you guys some questions. So we have a quick poll. It is only a one question poll. Mm-hmm. So the purpose of it is really to find out what we can do for you. So Kirsten will put up the poll. In the meantime, keep introducing yourself on chat and let us know what your favorite cookie is for the holiday season. So we really just want to know what is most useful to you in these meetings. Once the fruit does that, sounds like a drink. And Vicky is new with us. Welcome, Vicky.
Thank you.
So we know that everybody has a lot of meetings and we want to make sure that it's useful to you. So we are going to take these very seriously. So please tell us. The last thing we want to do is waste your time because we know you have a lot going on. And our job's really to support you. So let us know how we support you best. And so today we're going to have Curtis Chan, Dr. Chan and Tanya Perez both talk to us about communications and about some updates. And then after that, we'll do our own updates as well. So I'm going to hand it over to Helen and go ahead and keep introducing yourself. And I think, has everybody had a chance to answer the poll? Okay, thanks a lot. We'll take the poll down.
Thanks, Petra. I was just going to introduce Dr. Chan and Tanya Perez. They're here from our San Mateo County Health Department. So thank you both for being here and taking the time. They're going to give us some COVID updates straight from our health department. So I'm going to go ahead and turn it over to Dr. Chan and Tanya. And did you want me to share my screen, Dr. Chan? I don't know. Yeah, okay.
That'll be great. Thank you.
Sounds good. I'll put those up now.
Thanks so much, everybody, for your valuable time during this holiday season. We really appreciate you. I saw the last part of the poll, and from our perspective, I think hearing from you all about what the community needs is probably the most important thing for us. And I think what needs to be better developed, and I think we're getting a clearer green light that we can develop it, is like hearing what the community needs are and more clearly and have a better system to develop messages that all of us can share together. So really grateful for Thrive to convene this group, and always been super grateful for Office of Community Affairs to be able to work with you all to develop those messages. So I think we got to get stronger on that. I mean, we're getting stronger as a county, and you can see that the context of my 7 slides is related to that. So, okay. So the first slide.
Sorry, Kirsten, could you give me share access, please? And I can.
You should be good now.
And we have Roger, yeah, thanks so much, Helen. So I think these are the 4 topics that I think, Helen, you mentioned that community members had questions about. So I think one broad overall context is just to think about where we were last year. I think, when for the Board of Supervisors meeting, it's like looking at previous notes, when we convened kind of, I'm not too sure if it was with OCA, but we had several meetings back in December of last year. And our conversations during the first 2 weeks were, I think I was not as calm as I am now, because I was really worried about I think at that time I was estimating 300 deaths that were going to happen by February. And, that actually, and I think people thought I was being hyperbolic about it, but, that actually happened. So, I don't think 300 deaths are going to happen again this year, but it could be 30 deaths, it could be 60 deaths, and we want to limit it down to, let's say, 10. And some of you may say, let's make it 0 deaths. So I just want to say I super appreciate you all spending your very, very valuable time on this, because we all think this is a really serious issue. We're going to be doing 2 things. We need to prevent deaths, prevent hospitalizations, and we need to get better as a county about how we actually engage and inform our community members, because there's going to be future waves that come, and we're going to have to shift very rapidly. Not everybody's going to be convinced about getting the vaccinations right away. There's going to be ongoing needs for boosters. There's going to be this on and off switch of when you need masks, when you should cancel or modify holiday parties. And it's going to continue. So let's not think, we got to just do with it, prevent hospitalizations and deaths for these next several weeks, but also continue this effort throughout 2022 and get better from 2022 to 2024. So I think that's the overall context of this. Like, we need to continue to, I think when Helen asks me to talk, I'm always like, okay, the maximum is 20 minutes, because we should try to spend 70 minutes listening to you instead. So several key points. I think you all are hearing it, and people are reading information on the newspaper every day. So the need now to describe information is a little bit less than in previous months, but the information is changing really quickly. So several, like 2 to 3 key points for each one. I think now it's like very clear, the science community is going to totally confirm it soon, but you could put on your messaging now. It's very valuable. So like one key reason why community messengers is important, because the way that scientists speak is like just kind of like what I did, it's like with a bit of uncertainty, because we always think about 95% confidence intervals, and you want to do every single study has to be published and peer reviewed until the CDC says it's going to be right. But I think you should say, from a lay person's perspective and community perspective, just really emphasize that this is definitely more transmissible than the Delta variant. A key aspect is that there's always like this is to address like the questions about, I've been infected already. Do I need a booster shot? Do I need a vaccine? But what the studies have shown is that there's a significant amount of immune escape from past infections and vaccines. So all the CDC presentations that happened on October 21st and 22nd that Dr. Chabra highlighted last week for the VCWG, I mean, they're basically showing that it's about, from our like talking from a governmental leader to a community leader perspective, it's about like, I would say 70% effective now in terms of preventing infections. So you might, and this is the part where it's helpful for you all to communicate this to your community in the best way possible. And I'll show you where the resources are. So the reason for this is when we talked last year, remember last year at this time was when we first got the studies back about the efficacy of the vaccine. Remember, and at that time, so what we saw, and that was of the, what we call the wild type virus. So that wild type virus, so at that time, that was 95% effective, right? So prevented, if like people who are vaccinated, 95%, that means 20 people who are unvaccinated are going to get the infection, and only to one person who is vaccinated is going to get the infection. But with 70% effective, it's basically 7-3, right? It's protective, but it's kind of more like 2-1 instead of 20-1. So it is a lot more transmissible. So that's why you're seeing so many people who are infected, who have been vaccinated, are getting infected. So I'll just say a little bit more about like why this is important. So just a brief, this is the holidays and just what we've gone through this past year, right? So back in December, we were like, okay, this is, wow, we're all going to get the vaccine. We need to convince our community members this is 95% effective. And then like around like December 23rd, right before Christmas, we heard about this virus from the UK. You guys remember that? There's like, and that was what's later termed the Alpha. It was later termed like the Alpha variant. So that was back in, so then, like we all hustled like, wow, this is more transmissible at that time. So then, like, okay, we're Alpha variant, okay, it's definitely more transmissible, but then the vaccine got rolled out and like, still pretty like protective against the Alpha variant. And then in March and April, we heard a little bit from like reports in South Asia, from India, for example, and Europe about the Delta variant. So, but it was over there, and then, but at the same time, people were exhausted, and the state and the CDC said, wow, we're still dealing with the Alpha variant from the UK at that time. And then we said, okay, everybody who is vaccinated, they don't need to wear masks anymore. They don't need to isolate and quarantine anymore. So that message was out like in the beginning of May. And then, but then from May until July, that's really when the Delta variant swept through the country. And what we learned from the Delta variant, that there was, what we see more of from the Omicron variant, that there was immune escape from past infections, and there's also escape from the vaccine. So what we learned was that basically 2 doses of the vaccine wasn't good enough. So basically, so the Delta variant swept through the United States from May to July, and now it's the dominant variant until now that we're hearing about Omicron. So, what we're hearing from Omicron is about this immune escape from past infections and vaccine. It's definitely more transmissible. You're hearing some reports, and you're going to hear some misinformation about that it's mild. It might be milder, but it's definitely causing also severe disease. It's definitely causing hospitalizations. So I don't think we should not overly alarm people saying that this is more severe, but also don't allow like people from the community to stand up at a large community party and says, oh, this is nothing, it's just like the common cold too. It doesn't look like that's the case. Like there's definitely many people who are with severe disease and people who are hospitalized. So that's a key point. So that's the Omicron variant. We could ask more questions later on. So I think a medical epidemiology comment about the vaccines for children. So just to remember for people that this data was only available really in early November. So a lot of our community members are still like digesting this information through Thanksgiving and this holiday season. So, it's still important that like maybe holiday discussions are going to happen with family members, and we definitely want to convince family members about the importance of vaccination. So it's very clear that it's safe. For you all, for some additional information to communicate to members is, that it looks like it's causing fewer side effects, and there's even less risk for younger children, 5 to 11, than there's for adolescents and young adults. The medical biological theory about this is like there's less, some of the adolescent hormones, particularly testosterone, is thought to interact with the immune process. But like, so basically there's like very low or negligible risk of myocarditis, the heart inflammation, or a venous sinus thrombosis, any like clotting problems for young women. It's really like close to non-existent for children. So the key information is like that is safe. Many kids are, I think this is probably more information than most community members want from a flyer, but if you're answering questions, this is the reason why I'm providing a little bit more information as you all, for you all as community leaders. But the major thing is that there's fewer side effects. I think what we've learned from like surveys is like that many families just want to know that many kids have been immunized and without any major side effects. And in San Mateo County, over 40% of our children 5 to 11 have received their first dose, and we've really seen like this is a very safe vaccine. The key point for children is that it's very effective in preventing infections to children themselves, and some children are getting hospitalized. Many more children got hospitalized for COVID than influenza last year. And it's really important for children not to be infected because they could still infect their parents and grandparents and grandnephews and uncles. So the third point is about booster doses. I think I touched upon this already, and I think three main messages, and I have some references in the future slides, is that basically the summary of the CDC studies on October 22nd were basically that the primary vaccine series wanes after 6 months. You could see like this big dip from like 90 to 95. By 4 months, it starts getting down to like in the 80s, and depending if it's the Janssen vaccine, the Pfizer vaccine, or the Moderna vaccine, it dips even lower to 70s and 80s. Some of the studies are a little bit fuzzy in my brain right now, so I can't cite the exact number for each one, but that's the overall concept. And you also see from the studies that that's presented in October 22nd from the CDC that the vaccine series wanes, I mean, it's decreased with Delta compared to the Alpha variant that was from the UK. And I think what we're finding is that the Omicron, oops, I forgot to end there. The Omicron, that's what there's probably gonna be even more vaccine escape for the Omicron virus. So again, it's critical to prevent severe disease amongst older adults. I think the primary series is still effective, like, so I think like if I was going to argue with my grand or like an auntie or something like that, I'd probably strongly urge it. I wouldn't trying to think about, I'm not going to cause maybe too much of a scene, but we really want to do it over the holidays. But I think I really want to emphasize, I truly want my auntie and my uncles to be vaccinated because it's still going to prevent hospitalizations and deaths. I think 2 series probably still prevents a lot of deaths, but we definitely want them vaccinated. It's important for me as a physician to say that. And then another important thing, so that's really for older adults who want to emphasize to that community. And I think the overall thing for children 16 and above, and like adults, who are young and middle-aged adults, it's still very important for them that booster shot is going to prevent them from getting infection. It'll be raising it from like in the 70s to like the 90% effective in getting infected, as well as if you're not infected, then you're not going to transmit to other people as well too. So that's the importance of the booster. Those are the 3 messages I think are most critical for the booster dose and the scientific reasons for it. So the holiday messaging. So I think I described this earlier, and just think about the overall context, like many of you have some holiday messages out already. CDC and CDPH were a little bit slow on this, mostly because everybody's been waiting for like the studies on Omicron. I mean, if it shows that it's more severe, and there's more information about it being transmissible, like if it shows us more severe, like the the restrictions are going to be a lot different. And you're seeing this like in Europe where they're closing down places, right? And like in New York, where you're getting these major outbreaks, like they're like totally canceling holiday parties over there, right? So, and as well as Michigan, where they're getting like in other parts of the United States where there's like a severe crunch on hospitals. So, I think the messages in California are pretty mild right now in terms of restrictions for holiday parties, but it actually might be amped up a little bit. So the next slide. So, I think, oops, thank you. So, the next 6 slides, I have just basically some screen snapshots from the CDC and the CDPH. And this is kind of like the index or instruction sheets about how to utilize them. And these are some of these things that Tanya Perez and Daryl Lampkin have adapted the GARE framework for us to remind ourselves to utilize. Like when we're doing messaging or when we're making a policy for a community, just always have like these 4 pillars in mind. One is like just making sure that we have like the data is accurate. So, I mean, right now the highlighted data is like that. If you look at our smchealth.org website on our data dashboard, it's really stark what the disparities are. I mean, it might be a little bit better in San Mateo than California, but the racial inequities and who's getting immunized for the booster shots is really wide right now. The Black and Latinx community is lagging far behind, and that really speaks to the amount of education and trust that we need to build as governmental leaders and community-based organization leaders. So that's on there, and I think that's helpful to hopefully motivate and inform your staff as well as your funders about why this work is really critical. The data itself is evolving pretty quickly. You'll see, like, I mean, every 2 to 3 days, the CDC updates their website about like the findings about the transmissibility for Omicron. CDPH has some data as well too, but so look at those data sources. Again, really appreciate that you're all addressing the racial and social inequities faced by your community, and just acknowledge that me in my role as the deputy health officer, and from what I can see from our health department, like we and my knowledge of other healthcare institutions, the major healthcare institutions aren't doing an adequate job or can't do an adequate enough job, like really addressing all the racial and social inequities faced by the communities that are related to the messaging, related to the vaccine, the exposure risk during the holidays, why you need to get tested, and later on we're going to get more testing modalities offered to our communities. We're going to be getting rapid tests that are going to be increasingly available. We'd like to disseminate through the community at the start of the new year, as well as therapies too. There's going to be more and more outpatient therapies, and we're going to need to engage all of you to get the information out there so that patients can ask for this information or informed about this information. So there's a lot of like trust and inequities and access inequities, how people structure their lives and are available to, and their healthcare access, that we appreciate all of you addressing and leading on. So this is important this is again the importance of community engagement. So we acknowledge there's a lot of information about COVID in the general media, and most state and federal and county governments, we speak to generally the majority and those who are in power, but there's huge gaps of those who are in the minority, and some it might be 5 to 12, 15% of the population. We're just not structured to do an adequate job for each of these communities. Oh, my computer just logged myself out. Can you all hear me?
Yes.
Yes, we can hear you.
It takes like 30 seconds. Well, I think this speaks to why like government is not structured to handle it well. Because it's like, if any of you have seen us logging on from Zoom before, whenever each of us gets logged out because of security reasons, it takes like 30 seconds for us to like log back in because of governmental bureaucracy security reasons. Like that's an example of us not being nimble. I'm back on now. So like that's a so and I think you're seeing from you can see from the CDC information that's available in the scientific reports to the actual messages that CDPH and CDC are able to put out. There's a huge wide gap on that, right? Like there isn't like this like nimble way in which they're able to translate like information from the October 22nd, like scientific reports down to like visual messages for community members. That vetting process at the federal and Sacramento level take a long time. So that's like the reason why there's disparity. So like community members who have access to like higher education who can read these like complex reports are more likely to like get vaccinated first. Whereas communities who've historically had less access to like PhD programs have basically less access. So my final point is to align activities and mutually reinforce. So like this is the part that Tanya and I and Helen and Emma have been talking about and asking for. We continually try to want to build that as you're developing materials and communities, if you'd like to share back with us, figure out ways in which we can support you, endorse it in any way, your communications in any way, participate in your meetings, please let us know. Tanya, Daryl, and their teams, we're definitely here for you, and as well as the vaccination teams and the communicable disease teams. So next slide. So these are some of the key resources. So you could just put on the links on, and then like I've done some like snapshots in the future in the next slides. So these are the major resources from the CDC and California Department of Public Health. And you'll see that this is here, like the Omicron variant, what you need to know from the general public. It's a good summary of epidemiology, the science of the virus, the science brief, and I think you can almost adapt all the material from the CDC information. And so much of the material there is written still in a pretty scientific way. I think you could adapt, it's translated into Spanish on the website. You can just click it over, but a lot of things to make it culturally relevant. If you could just make some tweaks and adaptations to that, please do. And again, if you'd like our endorsement, I think working with OCA and Tanya and myself, we're happy to take a look at it as well too, but you can definitely take ownership of it. And this will be another important example in which community leads and helps change local governmental practice. So what's probably for you and your staff is the science brief that continues to get updated from the CDC. I'm going to show you the CDC holiday celebrations and the CDPH holiday gatherings. And then I'll show you the California state guidelines. And Aaron, we can send out the slide for you as well too. But yeah, we can do it right now too. And I'm going to show you some of these links. So this is from the CDC. And I think what I'm like, actually the purpose of showing these next 5 or 6 slides is, one is give you an example of the holiday messaging that you can adapt. And the second one is that it'd be good to have consistency about what the future message is, to really reinforce like community practice, social norms, like what are the main messages we want to emphasize. So from the CDC website for the Omicron, you could see that 3 points that are really highlighted are: vaccines remain the best public health measure. talk about the importance of masking. And then just in the context of not just when government tells you you have to mandatorily mask, but what are the real situations in which masking is actually effective, and make that like either in the norm of an individual or a business is going to request it as a norm for its employees. And also the people who are planning parties as a social gathering, how do we actually make that a norm for organizations, churches, groups of people together? The third point is like tests, and we need to re-emphasize the importance of tests. So those are the three main points: vaccine, mask, and tests from the CDC. The next slide. This is from California, the state health department. So this is the tips for protecting yourselves and others in this holiday season. You can see there's some consistency, like vaccinated is the first message. They add this thing about, this is the major concept that we're going to be on now. I mean, there's also some people who don't want to be identified by the government. If they're tested, there's still some stigma and concern about basically reporting your positive test to the government. But the key message is, like, if anybody's sick with any virus, they should stay home for a certain amount of time. And you could see the same message about get tested from California Department of Public Health. And then there's all these like smaller bullet points there that require probably some interpretation and adaptations for specific community members. So take precautions if some of your group are unvaccinated. So, you know, that tip is actually can be much stronger and clearer from community rather than government requiring something. And then also be sure to wear a good mask that fits well. Some of the messages even from CDPH are not consistent, because they mention N95 and KN95s do the best job in filtering out viruses and particles, but they're still discouraging community members to buy N95. So that's like a little bit of an inconsistency. And then there's like an app about Activate California Notify. You know, if there's this web-based way, or not web-based, not GI, there's like a tech way in which using our phones that we've been in close encounter with somebody else who's positive. So next slide. And this is the tip sheet from California state government, and not just CDPH. And you could see, and you could adapt all these things from CDPH. CBOs could do this. And some of the messages, what's tricky in county government doing it is that some of these there's a lot of backlash, as you know, from government over prescribing too much and requiring too much. So some things are easy, like get vaccinated, but then like messages of like keep gathering small. It's like, why is the county manager or the board of supervisors mandating that I'm going to keep my gathering small for the holidays, right? Or the health officer saying this. If everyone at an indoor gathering is fully vaccinated, masks are optional. You know, like actually the state health officer might not even agree to that. You know, this is something that just got through and was printed at a certain time for the CDPH guidance. But like, these are things you could kind of adapt. You can adapt on your own, and they're actually still evolving. There's no total right or wrong way to communicate this, but it's more about the overall principles. So like, so many people are thinking that the health officers are going to prescribe, for example, wear a mask over your nose and mouth when social distancing is not possible. Like, they're asking like the health officers to, for example, make specific orders to like make sure the masks are over the nose, but that's like probably crossing the lines of health officer power. So the next slide. So, you know, with that last slide, you don't have to go back. You can see that list was like 12 bullet points long. But eventually where we want to get to in 2022 and beyond is kind of these like 5 things that we want community to self-implement and build capacity to do on their own. And you all represent important community groups and populations with particular experiences in the community. So basically, there's some things when we're now in this risk that SARS-CoV-2 is going to be endemic throughout the world, and there's going to be more variants, particularly in countries that coming from countries with less access to the vaccine, but also from people who are immunocompromised as well. So Delta and Omicron are not going to be the last strains. So it's going to be, that's the main reason to vaccinate. And I don't think it's not just because of Omicron, it's because of this, because it's endemic now. And then what we're going to need to learn from now until probably all 3 of my kids go to college, probably. So until I become, for a long time, it's like that. If somebody's sick, we really need to instill the practice of isolating. When you have symptoms, just don't go to the party. Don't just say, oh, it's not Omicron. It's probably not. I've been vaccinated. All that stuff. This is where society is going to go. Like, sorry, just don't go to the party. It's not the, just don't go to the party. Don't go to school. Don't try to get, and school shouldn't have like attendance awards anymore. Like, employers need to have good sick leave policies, and they can't encourage, like, workers need to demand sick time. Public health and government needs to ensure that sick time is available, paid sick leave is available. But we need to isolate when anybody's infectious or they're symptomatic. People need to isolate. And the third concept is like when to get tested or treated for when somebody is developing symptoms. So, and then the things to eventually build out, like the 4th and 5th things, is when there's an elevated risk, such as like really heightened when we were concerned about Omicron, is to wear a mask in different situations. And then all these like community and culturally specific ways to limit the number of close contacts depending on the situation. So it might be a holiday gathering, a family gathering, a cultural event, a religious event. But like, what are the ways to limit the number of close contacts? So it's not going to be like an overly prescribed, like, this is how you do it for this religious event. Like, government's probably not going to do that anymore, but you all can develop these best practices, put together a 1-page fact sheet, and we'd be happy to review it and disseminate and share it further. So that's the thing that I think we need to kind of build together. This like table right here probably is going to be the work that we need to do from January until June. Focus on this in 2022. Okay, I think those are my slides, and I'm going to stay on for the rest of this hour. So happy to listen more and learn from your perspectives. Thanks.
Thank you so much, Dr. Chan. Do we have any questions from the group? Henrietta?
Yes, thanks, Helen. Dr. Chen, it was mentioned in one of your slides that the vaccine series waned in about 6 months. So should we just assume, well, first of all, the question, how long do you think our booster shots will last? And should we simply assume that we might need another booster shot as the COVID-19 virus mutates more, and will children also need to have booster shots later down the road?
Yeah, that is the key question, Henrietta. It's good to always hear your voice and your good questions. What do I think? I'm guessing that immunity from the 3rd dose is going to last longer than the first 2 doses. I think we have like good examples of, children's vaccine series when the third dose lasts longer. So I think it'll be longer than 6 months. If I was a guess, I would guess 9 to 18, 24 months. I think that's why like we believe that this is going to possibly be an annual vaccine. So, so that's that. And I think the importance of, like, I don't know if anybody in writing has communicated well, but the problem with that communication is like when we're overemphasizing that 2 doses is not enough, you need a third dose. It's kind of what I think maybe you're alluding to, is that then people who haven't gotten their first dose are going to say, oh gosh, if I need to get 3 doses and a 4th dose later on, then like that's a big hurdle, like, it's one thing, but so it's important to say for a particular community, even 1 dose is still very helpful. So the first and second dose are still, so for older adults, still getting that first and second dose is still very helpful to prevent severe hospitalizations and deaths. I would much rather get 1 older adult vaccinated who's like 68 years old than 10 children vaccinated. Like, you vaccinating that 68-year-old adult is really key, because this threat isn't going away. Omicron isn't so mild that 68-year-old isn't going to die. So, I don't want to take that 1 in, let's say, 50 chance, or what that if that older adult gets infected. This is what's verbally coming in my mind, like I'm like, okay, that older adult is going to get hospitalized and have severe disease. I mean, a 1 in 50 chance is pretty high, like that's high, like it's not like 100% that person. So you could see my that's not I'm going to answer your questions. I'm starting to people are starting to see like my anxiety and concerns for that 68-year-old who's not immunized yet. So but you can see that's the root of my concern. Did I answer your question, Henrietta?
Basically.
Yeah, no, you could please, you could share your perspective as well too. What's confusing?
Well, I would almost think it might be better to get those 10 children vaccinated, because children are carriers and they could very well be asymptomatic. And they risk doing far more damage in the community.
Yeah, and you might be right more than me. So I think that your perspective, that's valuable too. And I think that's like they're both valuable. So, and your perspective, just because I said so, and I mean that might be a perspective like Fauci would maybe say that too, but it's not doesn't mean that we're right, because a certain calculation, there's a certain, if like 10, if you're imagining in your mind 10 people from a particular community who's like living in the same household as a older adult, you might be right. So I love it. So yes, you're right.
Dr. Chan, thank you very much.
Thank you, Henrietta.
Gloria?
Dr. Chan, could you help me understand what is in physicians or health workers' mind as to why it is they are not getting the vaccine or encouraging the vaccine? This is just impossible for me to understand. I need to talk to family members about this, and I have a cousin's son who's a physician, and he has discouraged the family, that particular family, from the vaccine. And I just want to understand that, or encourage the vaccine, or what can I say? They know they're science people. I just don't get it. imagine nobody gets it, but
Well, I mean, I think that it's interesting because this aspect of my work, like previously in San Francisco, is like it kind of resonates with the work that like I hadn't focused from communicable diseases for the past 10 years. I did previous to that. It's like in a way, like in our community here, like our overall 90 well over 90% of our community has gotten the first dose, which is incredible, right? Like, even when we're looking at who votes for what party and who votes for any particular issue, there's like a huge divide. It's not anywhere close to 90% agreement on who, let's say, even votes for Trump, for example, in San Mateo County. So I think this is an example of like we are generally in agreement. I think it's like to your point, Gloria. So we're in agreement. Second, I think the information is really complex. Like it's a lot of. I think it's what Henrietta was saying. Like, well, if it's not effective after 2 doses, like why if it's people are still transmitting, and one physician from UCSF said like you still be equally infectious because they're interpreting this particular study in this way. It's really confusing. And some of these messages and data that's being like amplified in social media, they're taking, that's why I was like, just stick to those major CDC messages. They're amplifying and twisting apart different messages and just taking those headlines. And that's just attracts like 15 to 30% of the people can be easily confused by that. So there's a lot of misinformation out there, and that's why it's really important for you all to, like, this is why I'm just explaining the overall concept. So when you're reading the study from the CDC, that links to that October 22nd study. When you look at the Omicron like web link, it links to those actual PowerPoint slides that Dr. Shabra used. The third and final point for this is like, I think there's good reasons. I mean, if the Department of Health and Human Services, DHHS, at the federal level is, putting out these major messages that I'm actually endorsing right now, Department of Health and Human Services, but DHS, Department of Homeland Security, I'm just like forgive DHS, Department of Homeland Security, is the agency that oversees ICE. Like, it's really, it's like I can just understand why community is not going to be trusting like the federal government to actually describe why you need to get vaccinated or not. And I think that's why, maybe it's a good point that you're making. Like, I should be maybe referencing more also healthcare institutions like Kaiser, for example, Kaiser and some of the major universities. The problem is actually like many of these major health organizations haven't put out like great information that's out there. So I think it's this combination of distrust, decentralized approach, and complex information. So we need to get that, whether some people say there's for the last 5% of the population or the last 20 to 30% of the population that we care about. So that's my opinion about that.
thank you. And I have a second question, if I may.
Sure. Oh,
Wondering
Gloria?
what.
Sorry, Gloria. We also we have taken up a lot of time with Dr. Chan. Do you mind just asking him later? Because Tanya needs a chance to present as well, and we only have 9 minutes left.
Of course.
Well, if folks have any questions, we do want to take them all. So please do put them in the chat. I'll collect them all for Dr. Chan and Tanya, and we will be sure to get the responses to you. I'm sorry
you.
about that. I wish we had more time, Gloria.
No problem. I understand.
That's what about that, Gloria. I think what I'm planning to do is just a series of questions for now. So Dr. Chen has graciously talked about how, some of this messaging is really complex and how right now, it seems like CBOs are better positioned to take some of the messaging and tweak it and make it more culturally relevant and things like that. So I have 2 questions, and we'll take a poll just by raise of hands so that we're able to see and learn from all of you how we can improve this information process. So from the first poll that you took, I think it was more than 60%. I don't know if you can put it back up, Kirsten. Like the most helpful thing by far, right, was hearing from Dr. Chan, 65%. What that signals to me is this yearning for up-to-date information, right? And having the latest and greatest to be able to do your jobs effectively. So the first question that I'm going to ask you, and if you agree with it, go ahead and put your hand up, either physically or on the screen. And can I ask Helen if you would count them for us, please?
Of course.
My first question I have is, do you feel as though so far SMC Health has provided you enough information to be effective in your outreach work? And I give you a couple minutes to respond. And this is, just trying to be as transparent as possible. Okay, I think we've got them all. All right, and then we'll check in with Helen to see what those numbers look like after.
I counted.
Oh. Go ahead, Helen.
Sorry, I'll do it after. I wasn't sure if you wanted it live.
The second thing is, how many of you feel comfortable taking the resources that Dr. Chan has presented you with today and modifying them for the populations that you serve, and feel like you can do that? All right, I see some hands. Perfect. Thank you for your participation. So we just have a few more minutes, and I want to make sure people still have time for questions. So what Dr. Chan, I think, was also emphasizing earlier is because health departments are set up to really provide messaging to, and I won't even use the word majority, because San Mateo County is a majority minority population county, but perhaps to folks that are in power. We want to make sure that you're all receiving the right amount of information and guidance so that you can continue to do your work well. And that includes building a system that is not reliant on one person, aka Dr. Chan, to be in 50 places at the same time, right? Because while we're more than happy to be able to do that, we also want to learn from you what an effective process could look like. And I know we don't have very much time, but what an effective process could look like if, let's say, Dr. Chan wasn't able to join all of our meetings, not saying that he won't be, but what that might look like for you and be an effective way of us communicating with all of you, and not just those in this room, because we have many more CBOs that we're working with, right? So that you all have up-to-date information and can then, nuestra casa can take the information and create something that's more Latinx focused, and other organizations more senior focused or anything like that, because we do need the messaging about these populations that we might not be reaching, and you all are key messengers, right? So we want to make sure that you're empowered enough to be able to run with the messages, and that we are holding up our side of the bargain by giving you enough information to be able to do that in a systemic way. So I don't know if anyone has any thoughts on that in the last 4 minutes that we have together. We'll take any thoughts or feedback on what that process might look like, so that you all can have the most up-to-date information beyond into 2022, right?
Feel free to put any thoughts in the chat. You can always email them to me as well at a later date if you think of anything, and I can pass them on to Tanya. In my email in the chat, I think most of you all already have it though. And I just want to thank Miriam and Gloria. I do have your questions, and I'll pass those on to Dr. Chan and Tanya, and we'll be sure to get answers to you.
And as always, we will send out the slides and notes from the meeting. Kirsten will. Thank you, Kirsten. So thank you all so much. Special thank you to Dr. Chan and to Tanya Perez for coming and sharing your wisdom. And fingers crossed that there will be no surge over the holidays. But we hope everyone has some time to decompress, and we will see you all in January. Thank you.
Thank you all so much, and just really appreciate I think I really appreciate the thumbs up that Tanya did in the poll. You know, I think there's a lot of people who don't have thumbs up. Like I probably would have not given a thumbs up for myself or how government has been doing. I mean, we could just do so much better, and yeah, I think we do need to do better. So please do hold us accountable, and I think I deserve at least a C- maybe, but like we really need, like, there isn't a system for doing this, and we don't have enough information for community members out there. So, you know, like, so please just go ahead and do it. If there's anything I can help with, please just email Helen, Tanya, and myself, and we will do the best we can. Community members do not have this information, so we can't give ourselves thumbs ups right now. So, and it's I mean, rest during the holidays, enjoy. We've all been doing a great job, but let's for 2022, let's all do even better. So thank you though. Thank you, Tanya.
Thank you, Dr. Shen. Thank you. You've made a big difference. You really have. I think you've been present, and you've expressed your commitment to us in the community. And it's just the beginning of a lot of stuff that should continue for our community to be lifted from the history. So appreciate it. Thank you. And all the partners are doing fantastic work. And wish you all a Merry Christmas. And I appreciate the fact that you remind us to rest. There's a lot coming at us.
We should enjoy.
Thank you.
Take care, everybody.
Thank you.
Thanks so much. Thanks, Petra.